There are several staging systems currently being used to determine whether patients are in the early stages of the disease or the advanced stages. Mesothelioma staging is absolutely necessary in order to create an effective treatment plan for mesothelioma patients. The staging systems include the Bouchard staging system, the Brigham staging system, and the TNM staging system. The TNM staging system was created by the American Joint Committee on Cancer. The TNM staging system is considered the major staging system. T stands for tumor, and it refers to the tumor size and how far it is spread to nearby organs. N stands for spread to lymph nodes, and M stands for metastasis. This means whether the mesothelioma has spread to other organs. The TNM staging system assigns categories and numbers to determine the overall mesothelioma stage. There are 4 mesothelioma stages doctors may assign once the TNM staging system is complete. The first stage is localized. The other 3 are considered advanced stages. In stage 1, the disease has not spread beyond the confines of the mesothelium of the chest wall. It may also be found on the lung, diaphragm, and/or the sac surrounding the heart. At this point, mesothelioma is relatively easy to treat by surgical removal. In addition to the diseased tissue, the oncologist will remove some of the surrounding healthy tissues as well. If the disease is still localized but found in more than one location, the oncologist may perform a pleurectomy, which is the removal of the outer membrane surrounding the lung. In addition, radiation therapy may be used to relieve symptoms of the disease. Other treatment options in the early stage may include direct injection of anti-cancer medications following surgical removal of cancerous tissue. By stage 2, the malignancy has spread beyond the mesothelium of the chest wall and has moved into the lung tissue and/or the diaphragm, but not into the lymph nodes. Stage 3 mesothelioma is characterized by spread into the fatty part of the mediastinum and/or into the lymph nodes within the thorax. Malignancy may also have spread beyond the diaphragm and into the lining of the abdominal wall, which is known as the peritoneum. By the time mesothelioma has reached stage 4, it has spread to organs and tissues far from the respiratory system and/or invades critical structures such as the heart, spine, and esophagus. During the staging process, several tests and procedures may be used, including chest X-ray, CAT scan or CT scan, magnetic resonance imaging or MRI, and endoscopic ultrasound. Chest X-ray involves an X-ray of all the bones and organs inside the chest. A CAT scan is a procedure that takes pictures from different angles of the abdomen and chest. Also called computed tomography, computerized tomography, or computerized axial tomography, CAT scan images are created by a computer linked to an X-ray machine, and in some cases a dye may be swallowed or injected, making tissues and organs easier to see. Magnetic resonance imaging, or nuclear magnetic resonance imaging, uses a magnet, radio waves, and a computer to create detailed pictures of the abdomen or chest. Endoscopic ultrasound is also called endosonography. It is a procedure that involves the insertion of an endoscope, which is a thin tube-like instrument with a light and a lens for viewing. This goes into the body. A probe at the end of the endoscope bounces high-energy sound waves or ultrasound off internal tissues or organs. This creates echoes, which form a picture of body tissues. The picture of body tissues is called a sonogram. Endoscopic ultrasound may be used to help guide fine needle aspiration biopsy of the lymph nodes and lung, as well as other areas of the body. Once the stage, type of mesothelioma, and overall health of the patient have been determined, the doctor will explore the various treatment methods. The treatments and methods used for treating mesothelioma can be divided into 2 types: traditional mesothelioma treatment and new mesothelioma treatments. Traditional mesothelioma treatments include surgery, which is pleurectomy decortication or PD, extrapleural pneumonectomy, pleurodesis, and peritonectomy. chemotherapy and radiation therapy or radiotherapy. Radiation therapy or radiotherapy involves the use of high-energy rays to shrink tumors and kill cancer cells, but it only affects the cancer cells in the treated area only. There are two types of radiotherapy, including external radiation and internal radiation therapy. External radiation is generated through a machine, and internal radiation therapy is delivered directly to the source of the cancer by placing radioactive materials into the body through small tubes. In many cases, a trimodality approach is employed, which means several treatments are combined for the best outcomes, for a better chance at long-term survival and/or a better quality of life. New mesothelioma treatments include gene therapy, photodynamic therapy, or PDT, immunotherapy, intensity-modulated radiation therapy, or IMRT, and the development of new chemotherapy agents. In addition to these new mesothelioma treatments, there are several other radical treatments available, including angiogenesis therapies, anti-neoplastin therapy, mesothelioma clinical trials, interferon and interleukin therapy, and radiofrequency ablation. A wide variety of complementary and alternative mesothelioma treatments also exist, such as herbal products, special diets, homeopathic medicine, acupuncture, therapeutic massage, high-dose vitamin C, Laetrile, and Eastern medicines. Briefly, the Bouchard staging system was created by cardiothoracic surgeon Eric G. Bouchard, and it is still the oldest of all staging systems. It is based on the magnitude of the primary tumor mass. While the Bouchard staging system has been around since the 1970s, it is still currently being used by many specialists for its advantage of simplicity and relevance to prognosis and therapeutic options. The Brigham staging system also uses 4 stages. It is based on whether the mesothelioma can be treated or removed by surgery. It is also based on whether or not the body's lymph nodes are involved.
Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.